What's good, YouTube? It is Dr. D back for another video. And actually, I left my OB appointment that I did the stress test, and they just sent me straight in here to triage. I'll tell you, it's one thing after another. So it didn't go as good as it was supposed to over there. I guess y'all heard some of the footage of what they were telling me when they walked in. But I am in where the place I would have the baby, but in the triage area of it, like the emergency side of it. I came here some months ago. You can hear the baby moving louder over there. And what the issue was, guys, is that his heart rate was at 10 beats per minute per axle. And it should be at 15. Based on what she was explaining to me in the last videos y'all seen me, it's the same day. I ran straight from over OB to this place, which was in the same parking lot. And I'm still supposed to go see high risk if I can get out of here or adequate enough time. So they're doing the retest here because they have more stuff to look at and possibly like an ultrasound if it doesn't meet the criteria that it's supposed to meet. So keep me and baby in prayer that he meet this criteria so we can keep it moving. He told me he probably won't even sign me out if he didn't meet the criteria. I know he's fine. You can hear him here. He's fine. Got my Bible with me. You know God is with us. But I'm just updating y'all and letting you know what's going on. It's been so crazy. This pregnancy has been so crazy, y'all. But I'm so thankful. He's such a good one. Good baby. Besides him, let me sleep. Or it's probably going to be the case in real life, too. But we are doing good overall. Uh-oh, knock this stuff over. And as usual, I'm out of breath. They put the same things on me. It's not like a storm coming through, don't it? That is scary. They say, well, how old are you? I told them my age. They say, well, you look good. What's your secret? I said, I'm vegan. Okay, I'm vegan. I'm eating my Del Taco that my hubby brought. Did you hear that? I thought that was like a storm coming through.
I'm going to just use him like swirling in there. I'm going to just baby, okay?
Oh. So he acting up already.
Yeah, that's better. Oh. He's still kind of doing it there.
He always hits these things.
Are you in any pain, Mama?
Mm-mm.
Okay.
Does it show him contracting?
Let me see.
Because I can't tell. Obviously.
I do see some contractions. Have you used the restroom? You have, huh?
Mm-hmm.
So you're not feeling anything at all?
Mm-hmm.
So I do see some.
Is that a good thing?
How many weeks are you?
Because I can say it again.
How many weeks are you?
34.
No, we don't want you contracting at 34.
Okay.
So sometimes when you're dehydrated, have you been drinking water?
Mm-hmm. This is my second cup I'm getting ready to drink.
Okay. For the whole day today?
No, I sip on water all through.
Yeah.
When I get up to go to the bathroom throughout the night, I sip. And
the good thing is you're not feeling them, so they're not. Hopefully they're not dilating, but they'll probably check you.
Good thing that I'm not
Feeling the contraction.
Oh, yeah.
Yeah, because the more...
I think even when I go see Dr. Samadi, sometime I was contracting or something I wouldn't know.
Yeah, so they'll probably check you because you are having some contractions. Okay?
Meaning they'll do an ultrasound when you say check.
I don't know, but it depends what the doctor will order, but for sure a vaginal exam.
Okay.
Okay?
Got it. Thank you.
You know, having the axles, they'll probably do an ultrasound there.
So what about Dr. Samadi doing? Can he find out if it has access? Like, can y'all call over there and tell him what's going on?
Well, he can't do this. I mean, I think the best that would happen is you would go to Dr. Samadi's and then go to triage later, based off of ask him like, you can even, yeah. I would ask. Let me see. Think.
If you write me in the sticky with the words, correct words, I can
Yes.
send it. You can take it with me.
So, what?
I thought he had good enough activity.
He has great activity. So the thing is that when I see stuff like this, you see his variability is really good. He has some small accels, that are like 10 beats accels.
Okay, I'm gonna see this quarter start here. Okay, I'm listening.
But he has no D cells, so that's all good. So I think, he's doing well, but he's not doing well enough for our criteria, which is he should be doing 15 beat accels.
15 beat accels. Okay.
Yes, but he's only doing 10. So in that case,
what usually indicates? What determines if he do 10 beat accels?
that his heart is changing 10 beats per minute
instead of it should be at 15.
Yeah, but he looks good.
So what happens if we get there and it's the same thing?
Then they're going to do an ultrasound.
Okay.
Because they're going to, so that's the thing is we don't have here the ability to do, oops, this is making so much noise. We don't have the ability to do, the full workup here in this office, but there they can do an ultrasound and this test, and the doctor can, decide based on all of that information.
Okay. Okay. So I'm trying to figure out if I should, yeah.
Do you want me to help you take this
Yes,
off?
please. Okay, YouTube. So I am back again. Still the same day. I've done OB, emergency room, triage, and then I did high risk. And I wanted to give y'all an update and let y'all know that basically, the good news I found out today is that I don't have placenta previa no more. I put some little celebration stuff up on the screen for that. Okay. Basically, he said that means I can have a vaginal birth, but we know that I have a C-section scheduled, and that means it's a VBAC if I do it this way, because both of the C-sections I had were already taking place. My face feels oily. Okay, I guess that's better up, right? I need my shades on. Anyways, so I wanted to give y'all an update. My service is still moving down, and my placenta has not moved up. So my service is still shortening, and I think he said it was 1.9 2 weeks ago. Now it's 1.8. So it's getting down and down and down and down. So I'm gonna do a better job at resting, y'all, and not moving too fast, because I know that's my dang problem. And I don't even know if it can go back up at this point. That's like something I need to call my OB and ask tomorrow. Like, y'all, these weeks are coming so quick. And I still got so much, these weeks are coming so quick, and I still got so much to do. I'm gonna do my best to keep pushing though, y'all. I'm gonna get everything posted and done, and so that all I'm doing is just posting things. Excuse me. But I gotta get my review of all these, of all my videos, YouTube videos done, so I can just post them and post them. My goal is to post every day in May, which is May is 1st is Sunday. Ooh, I got a lot of work to do. Anyways, guys, I just wanted to let y'all know what was good. The baby ended up doing what he had to do for his heart rate. He ended up making it to 15 beats per minute per accel, ACCEL, so acceleration. So he did what he had to do. So he was like pretty much having a party in there. If you guys would look at the footage that I did earlier in this video from that time, he kept knocking the heart rate monitor off of him. They had to keep coming adjusting where he was positioned for the heart rate. Like, he moved so much, it was just crazy, to where they was hearing the noise out in the area where the nurses are, and they kept coming in and readjusting it. But he doing what he's supposed to do. Everything is really good with him at this point, guys. So, I just wish I had more time. I wish I didn't have an incompetent cervix. I wish that I didn't have all these issues going, so that I could technically wait my whole time out, at least to 39 weeks. That's what I'm planning. That's May 27th. So I'm hoping that's the case, but I really don't know, y'all, because he just really is the boss, not me no more. But I'm gonna do my best to take it easy, relax, even with doing housework, even with doing the laundry, even with doing all this stuff, because even when I have the C-section, I'm not gonna be able to do any of that stuff. So that's just where we at, y'all. I am just over the moon at this point. I did get my progesterone shot today. I haven't looked at it to see if it's bruised. It doesn't hurt as bad right there. I don't know if I'm getting used to them or what. I only have a few weeks left with them, but it don't hurt as bad. But I guess that's basically it for this video. This has been a long video, but I tried to give y'all as much footage as I could in one day. And I will see you guys in the next video. Don't forget to like, comment, subscribe, hit that post notification, and see y'all in the next video. I forgot to tell y'all that I actually got a 3D picture today, so I'll insert that in this video as well. So that worked out. So a couple of things worked out, even though we had like a little scare, which was pretty good. But anyways, just wanted to let y'all know I did get that. We finally have a picture, and I can't tell if he looks like my dad. Both my kids look like me and my dad when they came out. The genes is just so strong, but he looked like his dad in so many ways, but his eyes was closed and he had his hand over his face. So I tried to change positions so that he can be in a different position for me to get a better picture, and it made it worse. And then he put all his hands over his face like this. So he was not trying to be seen today. He was like a peekaboo. So, all right, guys, that's it.